This is not psychotherapy. Dr. Wills does not have a provider-patient relationship with this guest. These are just two people talking about emotions.
Welcome to Give a Actually with your host, Dr. Alex Wills.
Hey, welcome to Give a Fuck Actually. I'm Dr. Alex Wills. Today we have Craig Hope. Thanks for coming on, Craig.
Of course, thanks for having me.
So Craig actually works with us at Perma Mental Health. He is an AANP certified family nurse practitioner. He began his education at California State University, Chico, and later finished his graduate studies at California State University, Sonoma. He currently works as a full-time nurse practitioner at our Twin Falls, Idaho location. Craig and his wife and their 4 kids have lived in the Twin Falls area for the past couple of years. They love camping, mountain biking, playing games, and enjoying the Twin Falls area. Twin Falls is my hometown, so I'm quite partial to it myself. Their oldest daughter is recently married, her best friend, so they have gained another hardworking kid in their little clan. So anything else you wanted to add by way of introduction, Craig?
No, that's pretty good.
Okay. Awesome. Yeah, so tell us a little bit about yourself, your interest in mental health, and just kind of what would you like folks to know about you in addition to that?
Yeah, thank you. Well, Perma's really has been an extraordinary experience for me to be able to interact with patients in a different way than I have in the past. Back when I was an RN, I was working predominantly in critical care, ICU trauma, the ER for the majority of that. And we saw a lot of mental health, but our interactions with mental health were just so different. And so advancing my degree and I think doing kind of family medicine and some urgent care stuff, that was really fun too and a great experience. But I just can't compare that. It's just so much fun to do mental health. It's, I don't know, it's this gift that is so rewarding, being able to be a part of some pretty remarkable breakthroughs that patients get to have. That is very humbling and it's just such a cool experience. So that's kind of, I don't know, I've enjoyed it. It's been great. I didn't think I'd be like, mental health wasn't necessarily something I, was going for, but sort of stumbled upon it, and it's been perfect. It's been really great. So I've loved it a lot.
Yeah, mental health, it's a gift that keeps on giving. I almost became an ophthalmologist, and I ended up matching in Hawaii for psychiatry, and man, never looked back. It's just every week you learn some other precious thing that makes life so much better. So if any other providers out there are interested in doing mental health stuff, give us a call because we are expanding and we want to share the joy.
It's truly, you're right. The gift that keeps on giving. I'm humbled all the time by my patients. They're just so amazing. I learn stuff and go, oh boy, maybe I need to do something like that for my own life. So it's really a amazing experience.
Yeah, in the book, I give credit to my patients who really are my best teachers. They teach me what I'm doing right, what I'm doing wrong. They teach me what therapy works and what psychotherapy, psychobabble doesn't work, what doesn't fit for them. And, everyone's different, but that's really where the rubber meets the road, is when you see real change in real people's lives.
Absolutely. Yeah, couldn't agree more.
Do any examples come to mind of anything that's been life-changing, big or small for you, as far as stuff with your patients or just stuff you've kind of picked up since you've been in mental health the last couple of years?
Seeing patients being able to work through past trauma, I think seeing them be able to take a journey like through EMDR therapy or art therapy or it's maybe perhaps a different type of approach that they do with their own counselor. And then I get to see kind of the end result, as it were, not end result, but it's like they, the successful post-surgical patient, and they feel much better and do, it's just, they're, if you diagnose correctly, you get them the right therapy, maybe the right medicine, who knows, but I've seen so many folks have come into me and they have been a train wreck. Just absolutely. Their life is a mess. And we just take it step by step, work through the problems, and try to get them. It's sometimes like the patients are just coming from trauma histories that are so horrible, so dark, so kind of beyond my skill as far as like trauma. But, really, I just try to listen as best I can and give them that kind of unconditional positive regard, I think is what it's called, that, knowing that they are worth the effort, they're worth the work. And gosh, that has been so amazing to see people, like, despite horrible stuff that they've had to endure, really come out the other side and go, you know what, it's still a part of my past. It did happen, but there's no more emotional sting. There's no more emotional upheaval. And that is so cool. That is just really amazing to see that.
Yeah, that's great to hear. Yeah, that Adlerian psychotherapy approach of that unconditional positive regard. And that is the motto at Perma. It's we listen. We really want to be the providers that listen to folks and make sure that folks feel like they're being heard, and they are being heard, and especially validating their emotions and all that stuff. I'm curious, just generically, with radical emotional acceptance, we're always trying to think of how we can validate those painful, sad, scary emotions. And I'm wondering if, and if not, it's fine, but if any examples pop into mind of how that's been kind of helpful for patients in your work with them.
That has been probably a huge new perspective for them. When we talk about, and I think the idea of, like, there's no bad emotions, there's no bad colors. I use that all the time. I talk to my patients, and they're like, I could see their face kind of like look at me funny. They've never considered that, and I think, gosh, it's like, I don't know, 50, 60% of my patients, we're working through some emotion, we're working through something. And when we get to a point where it's like a good transition, a good safe place where we can say, I can bring it up and be like, well, where do you think this is coming from? Because I don't know. I don't know where this comes from, but sometimes I do. Sometimes I know enough about their history and their trauma, and I can ask them that, thinking for the most part, I think I know the answer, but to watch them kind of take a negative emotion that they don't like, that they push down, and that they are like, I hate this, and kind of look at it and go, where is this really coming from? What is this teaching you? Why does this seem to matter to you? And watching them think, watching them kind of like take a minute, and there has to be, kind of insight. There has to be, they have to be able to really think and kind of take a look inside. So that's sort of perhaps a prerequisite, but they, I had one patient who, when at a very, very young age, I think less than 10 years old, abandoned by her parents, by her mom, in a hospital. She was injured pretty badly, head injury, and saved, but last time she saw her mom was in the hospital bed. So mom just took off, never saw her again. So huge abandonment issues. And so we were able to, kind of correlate as an adult. Now she's, of course, a full-grown adult. So we talk about, like, why does that sting so much when people leave you? And why are you so anxiously engaged to attach to anyone that will, give you any time, give you any attention? And that has proven to be kind of difficult in her life because she's attached to some pretty toxic people herself. So that had really, I think, kind of looking at that in that perspective, like, where are these emotions coming from? When someone does leave, and oh yeah, okay, that's probably due to something that happened deep in my childhood. And, I don't know, I don't really like necessarily, I don't know that I'm good enough to really do session after session with that. Although sometimes I feel like I'm able to kind of open the door and go, there's probably a correlation here. There's probably something here. I want you to go see your therapist. I want you guys to work on this more. Go do EMDR therapy, really, really get to the bottom of that. And so that's, I think, kind of been some instances where the REA, I think, philosophy can be used to kind of really help people take a look inside and, see where those emotions are coming from.
Yeah. And by the way, for folks listening out there, we had spoken offline. Any examples we give are about fictionalized patients. We don't talk about actual patients or any, identifying information. But it's helpful to kind of talk about that type, like a child who went through some traumatic stuff and then they still have to deal with things as an adult. I'm curious, for people out there that aren't familiar with the color analogy, how emotions are like colors, how would you describe that briefly, Craig?
Oh, yeah. So thank you. If there's not, there's some emotions you don't like, vulnerability, maybe sadness, maybe, I don't know, anger. And these are emotions. They're human emotions. So if you're a human, they're part of your emotional sort of breadth, I guess. Just like on the spectrum of colors, there's no bad or good colors. There's just colors. So that was a really, I think, amazing part of, for me, like understanding the reason for emotion. Or so if a patient is saying, I just don't want to care about this situation right now, this person, it's making me feel really, really bad. That's like saying, I don't want to see the color green, or I don't want to see the color blue. It's kind of well, that's silly. You do see the color green. They exist. You're a human. You're going to see these colors. And so you're going to be upset. You're going to be mad. You're going to have some sad feelings of hurt or betrayal or vulnerability. And so it's, even though they're icky and we don't like them, it's, I think, something really important to understand, and that they're just a part of who you are. And it kind of reminds me of kind of swimming with the current a little bit instead of fighting upstream so much. That can become exhausting. You can have some pretty powerful currents. And so I think it's more appropriate perhaps to just swim with the current and kind of see where it can take you in positive directions, to understand, like, this is why I'm actually feeling this way. And I really feel like with the understanding really comes the cure. The more we can understand things.
Right. Yeah, when you realize that intense fear, intense sadness, intense emotional pain, it's not there just to hurt you, just to torture you for no reason. It's there to help you to get in touch with the reality of your relationships, your situation. It's trying to help you. And when we can finally see that, we realize it's not a problem. And then we can creatively use that current. I like that analogy of like a current, like a river. And you can go with the current and use that to navigate to the side of the river that you want to go to, rather than drowning by trying to swim upstream. It makes no sense. This podcast is an experiment to see in real time if we can apply some of this radical emotional acceptance stuff. So have you thought of anything that you wanted to talk about today, Craig, that maybe brought up some painful, difficult emotions for you?
I right off the bat, I knew exactly what I wanted to share. When I was 20, I'm LDS, right? So I served a mission for my church, and
what is LDS for folks out there that may not know?
I'm a member of the Church of Jesus Christ of Latter-day Saints. And when when the boys turn about 19 or so, now the age is earlier, but we get to, if we want, go serve a full-time mission, and basically they send you somewhere and you get to go wear the shirt and tie and talk to people and cool experience, really amazing. Loved it. Life changer for me. But while I served, my mom got sick and she died. She was sort of my person. She was my kind of anchor. And so I was way the heck out in California. She was back in Texas. And they made the decision to not really tell me that she got sick or that she had cancer. They wanted me to focus. I think at the beginning, they kind of thought, well, Craig needs to focus on his mission stuff, and things are fine. We're gonna get through this. And I still think that was a really bad idea. They should have told me. I ended up finding out through my mom's sister, my aunt, her sister, Kathy, and she told me, she wrote to me once and told me in a letter, and read the letter, and I thought, oh my gosh, what in the actual hell is this? And so I started, trying to get in touch with my family and trying to figure it out. And they, said, yes, Mom, Barb's got cancer. So that changed a lot for me. And over the next several months, they were going through different testing and treatment options, but ultimately she got really, really sick and it spread, unfortunately, and she died. So I got to actually, this doesn't happen often, but through a really cool chain of events, I was actually able to go home and see her before she passed. And that was great in certain ways because I did get to see her. And I think she saw me. She was lucid enough at one point. She did see me too. And I think that was really special. And then I stayed for about a week for the funeral, helped out with that. And then I got a chance. I was nearing the end of my mission. They gave me this option to stay home if I wanted to. And I was like, no, I want to go back to the field just because home was a really challenging thing at that particular moment. So, okay, funeral happened, went back to the mission field, finished out the mission, and that was good. A lot of things happened after that were really quick. Things happened, the kind of life-changing things, good things, but hard. So I met my wife, we got married, started having a family right away. That was, we didn't want to wait to have a family. So we started, we got pregnant, had kids. I started a career in logistics and then was going to go to school. So it just slingshotted me into this one direction. And I just kind of survived a lot of stuff. And as I look back, my family, all them, my aunts and uncles, and they all got a chance to really grieve for my mom, but I didn't. Things were a lot more difficult for me, I think, because I didn't really know she was sick, and then all of a sudden, a few months later, she's gone, and now I have to go back to the mission field, and there was this like ungrieved part. So. But I didn't really know that at the time. Yeah. I just was like, I just have to move on. And I'm a pretty happy guy. I just kind of go with things and I survive a lot of stuff and I'm fairly adaptable. So like 20 years later, here I am. I got, did some pretty hard things, working in the ER, back to grad school, got my NP. We moved. And I noticed that when I moved out here, I was having a hard time. I was really emotional. I noticed things were very difficult for me. My tolerances for stress were much lower. I argued a lot more with my wife. I kind of struggled a little bit there with kind of some, not bad, but it was just, I was just in this very emotional place and I didn't know what the heck was going on. And I ended up, I took my boy camping up there in the Sawtooth Mountains this last September. It was August, September. And it was just he and I. And we were outside of cell range, had no cell reception. The only thing I had to entertain me at night really was little games on my phone and then the book. actually give a F actually. That was pretty much the only thing I had. And I remember thinking, dang, why am I so emotional about all this? And I had all this time, he was, my kid was asleep, and, I was up late, my bedtime, when I turned my brain off is usually more like 10 or 11. So I sat up and I just read, and I got to a point, I can't remember what part it was, putting the shield down, putting the F down, and then kind of realizing what the more internal feelings that I was having. And it immediately was like, oh my gosh, there's issues with my mom. Like there's issues with, I am still really having emotional upheavals because of what I didn't go through with the loss of my mom. And so I was actually seeing a counselor at the time, and I think I might have mentioned to you what happened. I lost my counselor. He passed away. And anyway, so I came back home. I figured it. I was like, oh my gosh, I need to go do EMDR therapy. So I found a local counselor here, and yeah, it was absolutely amazing. The amount of grief and sadness that was still carrying this whole time. And we went through some EMDR therapy, which is, it's the new version of it. I don't exactly know. The eye movement desensitization reprocessing. And man, it was activating. It brought me almost right back to where I lost her. And it was so much emotion, so much sadness, but I kind of got it out and I got through it. And then it spilled over kind of into other areas. My emotional tolerances were much higher. Stress was no longer, it was kind of back to how I kind of had used to be. I guess back when I was a little younger, I was able to tolerate a lot more again. And it was quite amazing. My body was not letting that go, Yeah.
It's such a heartbreaking story, and I have to be honest. It's hard for me to kind of go there with you, because when I imagine being 20 years old and losing my mom, it provokes such deep, painful emotions, just the thought of it, and to imagine you going through that when like you're as a 20-year-old, we're kind of already on a mission to grow up and to kind of go out, become a man. And you literally were on a mission, a God-given mission on top of that. So that sort of sense of having to be a soldier, having to be strong, and very, very empowered in that way. Of course, that was sort of a tool of suppression that sometimes can be a strength when we need to accomplish something like that. However, those emotions, as you discovered, like you said, 20 years later, they don't just sort of magically go away, even if you do soldier on for a long time.
I remember I was in the hospital wing. I was in the hallway, and some other family members were in my mother's hospital room. And I remember having this thought, like, what am I going to do? Like, how am I supposed to move on? Before I did the therapy, I don't think I could have talked about this really. I would have been so stricken with emotion. I wouldn't have been able to really function or to really articulate this, but I can now. And I remember I came to this conclusion as I sat there in this hallway that I just have to soldier on. I just have to move forward, I guess. Like, I had no one to bounce this off of, no one to talk to really. My aunt was really an amazing source of strength for me at the time. She was such a hero for me. But I just was like, well, I guess I just got to deal with it and move on. But the part of me that I just still didn't grieve, and that was so you're right. I was able to sort of toughen it out and soldier on. And I think those are things perhaps our society likes to validate as really good things, like being tough, being stoic, but there is a part of that I had still not yet processed, and that was the actual grieving of her loss. I had to feel it I can talk about it now much more. Even my wife will tell you, like, for years I didn't talk about my mom, and I didn't really draw the connection. I didn't really think about why. But although, if I started to talk about her, I got really emotional and sad. So I was like, that's icky. Don't want to do that, And yeah.
Recently I've been doing some podcasts with the new masculinity and talking about what is masculinity. And I think a good point to make is that we traditionally kind of maybe wrap up this, I don't give a fuck.
Yeah.
I'm macho. I'm tough. I'm stoic. And it's considered to be a positive kind of manly, tough trait. However, if you think of courage and bravery as a desirable masculine trait, I think it takes a heck of a lot more courage to be vulnerable, to go in and to face those painful emotions. In a way, it's kind of cowardly to continually hide from them and try to avoid those sad, emotions, the painful
Absolutely.
mourning, loss,
It is very difficult to face them. That takes courage. That does take take a set of cojones, I suppose, to just say I'm gonna. Because really, the only way through it is through it. I can't bypass. I tried bypassing it for 20 years. I couldn't believe 20 years later, I was still caught up in those things and still kind of paralyzed by it. Couldn't believe it. What's that book?
So let's kind of go into it too. So Craig has dropped his fuck shield. He's realized that underneath the defense mechanisms, the suppression, maybe for him not so much anger, but a way of being stoic and whatnot. There still were these painful, vulnerable emotions. And so step number 2, naming the emotions. You said sadness. That's the one that you named, some pretty deep sadness. What other emotions can you name that you were going through or sometimes maybe still have come up when you think about it?
Vulnerability to be sad, because I still felt like I was a person that had to be constantly strong and I don't know, tough for my family. And really, so I have 3 girls and 1 boy. And it's really important, I think, for young women, teenagers, to see emotion in men. It's still like, that's very good. That's very healthy. And so, I think that has opened up a lot more opportunities for me to, in a calm way, to show some really solid, emotion at times. And that's totally fine. That's good. I think that means, people can be in touch with that healthy emotional side and,
Yeah. I don't know everything about the LDS faith, but from my friends and experiences around it, I have noticed sort of a unique thing, which is that it seems to be okay for men to show their emotions, sometimes publicly or in front of other people, and it seems to be an accepted thing and even a valued thing. And I don't know if what I've perceived is accurate, but I don't know if you can speak to that.
We have in our little congregations, we'll have regular people get up and speak, just members of the congregation. And some men, will get up there and show some emotion. I think part of it is, okay, you're in front of a big crowd and you're stressed anyway, but you're also talking about some very deep, deeply held sacred emotional things and perspectives and values and stuff. So that can be, I think you're right. Yeah, I think that's a good point. I think that is true. I think there's some maybe more liberal thinking on showing that emotion from men.
So kind of back to naming the emotions, we've come up so far with some sadness, vulnerability. I'm curious if you feel comfortable talking about it with the EMDR, what kind of stuff came up? Was there any fear? Was there any disappointment? Was there any resentment or anger? I mean, when I think about losing a parent at a young age, one of the first things that I think about is feeling like robbed, like something that shouldn't have been taken away from you was. And I have a lot of, hate. If that happened, I think I would just naturally feel hate for that situation or whatever. How about you?
Anger maybe towards my dad. He and I still kind of have a bit of a strained relationship, but there were some things that I think happened that and this was before I was in anything medical at all, so I didn't really understand. I just kind of went with the flow. Later on, as a medical professional, I kind of started to think like, wait a second, why didn't they do this? And I don't know, I think, and I wasn't there. Again, I was way out in California, so I had no idea, their discussions and the decisions that they were making, my mom and dad meeting.
Yeah.
But really, I think I did feel, it was just a lot of sadness, I think. I don't know that I felt maybe a little bit alone. Yeah. Because my mom was really my person. She was my anchor, and so that was, I think, feeling the aloneness and maybe a lot of sadness. And to be honest, like as I was, 20 years later, there was a lot of anger that I had. Oddly enough, I'm not really an angry person, I don't think, but I had to put down that. I remember reading that part of the book and going, gosh, I need to put down that anger shield, because it just, anger is interesting. Anger can be very activating and very, I don't know, maybe you can accomplish a lot with anger. It can like be intimidating, or I'm going to get some stuff done because I'm really mad. I don't know. But some people can use anger as kind of like a forward motion kind of thing if they tend to be sort of motivated or productive people. But
my take on it is, I don't, I hear that so often. So many folks come in and they say, I'm not an angry person. Some people take it as far as to say, I just don't really get angry. Like and I just, if we define emotions as like colors, right? We're going back to the color analogy. They happen to us. I don't think anybody wakes up and says like, you know what? I'm just going to be angry as hell today. Like I'm going to just be an angry person, But you could be walking around and you stub your toe and anger happens to you. It's like, that hurts like a you-know-what, right? So anger is like one of my favorite emotions because, like you said, it can be so activating. It can be empowering. If you use it for good, or if you use it for bad, you can be quite destructive, of course. So I don't want to throw the baby out with the bathwater and say that anger is a bad thing, or anger is something that we need to control. I used to do anger management courses for the veterans at the VA. We would have anger groups and anger management classes, and as if anger was a bad thing that we need to tame or whatever. Obviously, we want to separate out the destructive behavior that anger may be part of and make wise choices, but really validating that, because people oftentimes will complain that they don't have any motivation. They feel stuck. And it's such a activating, empowering emotion to get in touch with. Sometimes you gotta get mad as hell about stuff in order to give yourself a kick in the butt to get going. And so just tapping into the truth that when we think about all of the horrible things going on in the world, or things going on in our own lives, and tap into that stuff that really pisses us off, then we can transform that into positive action. But I'm curious how that's maybe fitting for
It's
you
very
in
true.
your
I think
experience, or not so much?
for me, I'm not as certainly explosive, or I get upset as easily. I think I'm a little bit more logical and cognitive, maybe, about something that's frustrating that's happening, which has been very useful for me. I don't know, like that, especially with kids and with my family. It just when something is frustrating, we can take a moment. We can just go out and like, okay, I need 10 minutes here, or 10 seconds, whatever, and you just go breathe. Come back in, and really, because when I need to discuss something with family members, it's so much better if I'm not angry. We can actually discuss things, because if I'm angry and I go in and, oh, I'm mad, and I yell, you did this, or, whatever it was, I don't know, you were disrespectful to me or to your mom or whatever, all they're going to hear essentially is just me being mad. We're not going to get to, look,
Right.
like, that's, whatever, it's not appropriate, it's not going to work. We need to come up with a better plan. We need to come up with something that is, workable to, and then they can see me managing kind of my own emotions and kind of being a lot more cognitive in being creative in how to find solutions rather than explosive anger.
Yeah, and to put it in terms of the steps of radical emotional acceptance for folks that might be trying to track it, we want to identify the anger, then we want to directly look underneath the anger and see what those vulnerable emotions are: sad, hurt, feeling alone, like you said, that painful loneliness, and maybe some fear too. The next step, of course, is to listen to those emotions and then to act on them. So we take the power of that anger, but we look with curiosity underneath it. We get all of our emotional wisdom, and not until we get to step 4 do we actually act. And part of our action might be choosing, instead of letting our loved ones know how pissed off we are, which is very true, we can let them know how sad we are. We can let them know how hurt we are, how scared we are. And that will awaken empathy and help them to feel closer to us. Whereas if we choose to unleash our anger, they're going to feel
Absolutely,
like further
feel
from
attacked,
us and scared of us, right?
And it's okay, but that doesn't really lead to a whole lot of like healing and moving forward in positive, good directions. Because you're right. I think when you actually start to discuss, this made me feel sad, this made me feel kind of rejected or abandoned or whatever, then you can really start to discuss, like, well, okay, I certainly didn't mean for that to happen, or what can I do? What am I doing that could be causing you to feel, or for the situation to facilitate feelings like that? So, I think, you're right. It's not until step 4 where there's actual action, which is great.
I've noticed with your story that's just so moving. It's heartbreaking, and it's also just so, it just really hits hard if you really put yourself in that position. We can often make the mistake of feeling like we need to justify our emotions. I noticed when you mentioned anger, you sort of explained it. There's this need to say, like, well, is it okay to be angry? Well, I guess I have to admit I was a little angry at my dad. And it's almost like we can't have emotions without a qualifier. We have to make sure that it's appropriate to have emotions. And so an alternative is simply allowing ourselves to have the emotions we have, whether we feel like they're justified by our story or not, or maybe we just don't even understand why we're having them for the moment. But we don't have to. We can just take that first step of realizing, like, oh, I look outside and I see the color purple. I have no freaking clue why, but the fact is I see a lot of purple right now. Makes no sense, but that's the truth. And the same can be true of emotions. Like, wow, I'm having some intense anger and maybe some intense loneliness, some painful loneliness. And I don't even really know why. I don't need to point fingers or justify it or blame anybody. I can just, that could be my starting point to just accept that emotional data without qualification.
That's very true.
What do you
think? I've had to do a little bit of work on sort of discovering why that anger existed. I think it's sort of evolved into, I think part of it, I learned some things that I originally thought were true that were not true, and perhaps some assumptions I had that were actually not true. So that definitely changed sort of my perception of what occurred at that time when I wasn't there. And so I think that gave me a little bit more like, well, okay. Yeah. I mean, I don't know. I wasn't there in those discussions. I wasn't a part of that whole thing, but so I think there's been a little bit more like me, maybe being a little bit more honest with, okay, did I somehow over the years kind of create this narrative of blame for someone else? But you're right. I think it's totally valid to be able to look and say, yep, I am angry, and maybe I don't know why, maybe I do, who knows, but I do. I just feel angry. And
yeah. Well, for what it's worth, based on, what you've told us today, I have some pretty strong emotions of anger come up, thinking about if I were in your shoes and if that happened to me and the way it happened. And, not only was like, she was your mom, she was your person. And then your ability to know what was like going on with her at that really crucial time was taken away from you. I have a lot of anger come up about that. And, not to say, blaming anybody or whose fault or whatever, but just, and I'm glad I do, because I think that tells me a certain truth, and what that, ends up being depends largely on your interpersonal relationships with everybody and so on. It's a very individual thing. But I would celebrate that emotion of anger and the deep hurt underneath, because that's reflective of how much, you loved her, how much,
absolutely.
The relationship,
totally agree.
Meant to you, right?
I tend to be a fairly easy to forgive kind of person, easy to move on, easy to just like, it's okay. Let's just,
Sure.
Maybe that could be an agreeableness, perhaps. But I don't know. A very difficult time for all involved, because she was the center of a lot of people's worlds. She was a pretty amazing human.
Can't imagine.
I think I had initially some like to God or to the world, like, what the hell? Like of all the people, gosh, she was the saint of a human. But
yeah,
I can't change what happened, so I just have to, find a way to have meaning out of it, to find meaning for me, and to kind of remember things she taught us, and to teach my girls, teach my kids about who she was. Yeah. Mm.
Yeah. And by the way, thanks for I think it's very brave and courageous, for you to share something that, is so deep and personal. And I think it's going to help folks out there that may hear this. As kind of a last point before we wrap up, I'm glad that you brought up the idea of forgiveness, because a lot of the clients that come in struggle with, should I forgive? Do I have to forgive? Mm-hmm. I can't be okay until I forgive. There's a lot of questions about it. And if you think about it with the steps of radical emotional acceptance, forgiveness becomes kind of a side issue, because by the time you get to step 4, the question of forgiving or not is really a personal decision, and emotionally, it is not necessarily consequential, meaning that you don't have to make that decision in order to still validate your own emotions, validate the intensity of your emotions, listen to the wisdom of the emotions, get really emotionally healthy with yourself, and do the same for, people that you're talking to with their emotions. And then the question of forgiveness or not, it kind of comes down to personal choice, morality, religious beliefs. If you do feel like your emotional wisdom is telling you that's the thing to do, then great. If you're still not sure about it, that's fine. But you don't have to get hung up on that as a condition to heal emotionally, is my point. And that can be very helpful, because I've seen so many people who get stuck for years because they're just conflicted about this concept of forgiveness.
Really, I think that would have to be sort of in my situation, that would have to be something I just decide for me. Because I can't change, or I can't, ask anyone else to have forgiveness or anything. it has to be something I just decide for myself, I guess, where I'm at. And but that can be very challenging for some people, and has been challenging for some of my patients. How do I bring in forgiveness to this equation? So it's very valid.
Well, before we wrap up, if people want to get in touch with you or follow you, or if they want to see you as a provider, anything else that you want us to know about?
Thank you so much for having me. And this is very cool. Such a cool background out your window. That's Boise, right? Yeah. That's so pretty.
Right.
Clear skies.
That's
I'm
Boise
very
lucky
to do what I do. It's really not a hard job at all. I'm very blessed. It's very cool, and Dr. Wills has been very helpful and influential for me. So it's been super fun. So all good things.
Yeah, and I can't say enough good about Craig. He's just such a great asset for the team. He's helped so many patients, gets, great feedback, and you can tell he just really does have a heart for mental health and helping folks. So thanks so much for being on, Craig. Hey guys, thanks for watching. This is Dr. Alex Wills with Give a F Actually. Make sure to check us out on Apple Podcasts or anywhere you get your podcasts.
Thanks for watching. Make sure to check out the merch store. RadicalEmotionalAcceptance.com. Bye.
Bye.